Okay, so acute coronary syndrome is whenever we're starting to get very concerned about the heart and heart health, right? It's related to acute ischemic attacks to the heart, meaning that suddenly the heart is not getting enough blood flow. It's considered unstable angina because it's at risk of damaging cardiac muscle. So we have a non-ST segment elevation type and an ST segment elevation type. You may have heard these called NSTEMIs and STEMIs. All right, we care about that because that tells us about the kind of damage that's going to lead to our heart. All right, it results from an unstable atherosclerotic plaque, from platelet aggregation, or from a thrombus that is formed in one of the coronary artery blood vessels. They are going to have unstable angina, all right, where something is now completely blocking flow to the heart and it isn't relieved by resting or nitroglycerin. Right, usually it's caused because the plaque has burst, the platelets have aggregated together and caused a blood clot, or from vasoconstriction, where this blood vessel has constricted and pinched down. It occurs even at rest. It lasts for longer than 20 minutes at a time. It doesn't help if they take their medications, right? And if we don't fix the occlusion and it impairs blood flow for a long time to the cardiac muscles, the cardiac muscle will die. Right. So what happens typically leading up to a heart attack is that we have coronary artery disease where there's plaque in those blood vessels to the heart. That leads to a narrowing of the coronary artery, and this deprives that cardiac muscle, also known as the myocardium, of oxygen and nutrients because it's ischemic. Right. It doesn't get the oxygen that it needs. It's often still alive, but it can't do its full functioning job. Right? As it progresses, eventually it's going to lead to total occlusion of the vessel, and this causes acute coronary syndrome or a heart attack, myocardial infarction. This can lead to irreversible myocardial damage, and if it's not treated in time and the damage is significant, it can be fatal. So for instance, in this image here, this is our coronary artery that had the plaque formation in it. It had then progressed to a complete occlusion, and all the cardiac muscle that this blood vessel was to supply then did not get the nutrients, and it has caused cardiac muscle death. So symptoms of a heart attack. Patients, and you have probably seen these, reported or talked about as you've been going through school or even just in normal life. All right, patients often report feeling chest pain. The medical word for that is angina. It can feel burning, tightness or pressure in the chest that lasts for several minutes or even longer. It can occur with exercise, emotional distress, or after eating a large meal. They will also often complain of pain elsewhere in the body, such as the upper arm or jaw. This is known as referred pain. What happens is that the nerve endings in the heart will also send nerve impulse signals of pain to these other locations in the body. They will also often experience nausea and vomiting, have difficulty breathing, known as dyspnea, be sweating very profusely, even if it's not hot outside, and this is known as diaphoresis. They can be lightheaded, extremely fatigued, and even have some heartburn. Right? Women, now this is what we typically think of. All right, this is what whenever we see somebody in a movie have a heart attack, they start acting like. Women tend to act much differently, and this is important because women, it's the number one cause of death is also cardiovascular disease. Right? They could have much more vague symptoms: unusual fatigue, right, sleep disturbances, shortness of breath, indigestion, anxiety, chest discomfort. Look at it. Only 30% of women who have suffered a heart attack complain of chest pain. Right? Many of these other symptoms, they pass off as being too busy, not getting enough sleep, having kids to take care of. And then once they get help, it's so late because they've already had cardiac muscle damage. So it's important that women realize that their symptoms can be much different. So to diagnose a heart attack, they have to do an assessment. So they're going to look at symptoms, risk factors. They're going to do an EKG test. That's where they put the electrodes on the heart or on the chest, and around the body to measure electrical activity of the heart. They're looking at that ST segment, particularly if it's below baseline, right, that's depression, or above baseline. This is very important, okay, so if it's below, right, known as ST segment depression, that signals ischemia. That means the heart muscle is not getting enough blood flow, but it has not died yet, right? Elevation, right, means that the tissue has infarcted. It's already been damaged, right? That tissue is dead, so it's a much more serious situation. They're also going to do lab work. All right, they're going to do what's known as serum cardiac values. They're looking at cardiac enzymes. All right, one of them is CKMB. This one tells us that there's been cardiac muscle damage, but it can also be falsely elevated because it can be after any muscle damage. All right, troponin 1 and troponin T are also cardiac enzymes, but they're specific only to cardiac muscle injury, so they tend to be more sensitive and a better indicator of if we've had damage to cardiac muscle. Right. If somebody's having a heart attack and we're taking care of them, right, it's going to depend on what kind of treatment they get on the severity of the ischemia or the infarction of the cardiac tissue. First line of defense is MONA. All right, we're going to give them morphine for pain, oxygen, nitroglycerin, and aspirin or Plavix. All right, morphine treats pain, oxygen helps to keep their tissues oxygenated, nitroglycerin dilates the blood vessels of the coronary arteries, and aspirin and Plavix are blood thinners that help blood to get around blockages easier. Right? They may also give thrombolytics. These are medications that dissolve clots. They could help with immediate reperfusion. So if we see ischemia, right, then we still have time to give the thrombolytics. If we see infarction, it's too late. Right. So we want to get blood flow back to the area. They're most effective if they're given 60 to 90 minutes from the beginning of symptoms, right? They can be used up to 12 hours, but this means that patients need to recognize the signs of the heart attack, even women, right, with their vague symptoms, and get treatment immediately, right, so they can have the best outcomes. Some procedures that can be done, right, they can do percutaneous transluminal coronary angioplasty, also known as balloon angioplasty, right, where they will insert a guide wire into the blockage area of the coronary artery. They will inflate a balloon on the guide wire to push the blockage open to try and restore blood flow. They can also do cardiac stenting. That's designed to prop the blood vessel open to keep it from collapsing back down if it's weakened. They can do a surgical procedure called a coronary artery bypass graft, or a CABG, you may have heard it called. All right, where they're going to take a vessel from somewhere else in the body, usually it's the left internal mammary artery, all right, and they're going to graft it around the area of the blockage. So let's look at some pictures so you see these. All right, so this is a balloon angioplasty. So they're going to insert the vessel, or insert the guide wire in the vessel where the obstruction is. All right, they will then inflate the balloon and push the sides of the vessel open, all right, to try and make the lumen bigger again to restore blood flow. This is a video if you're interested in watching how a stent is placed. You can click on the link in the PowerPoint. This is an image of a CABG procedure. All right, so for instance, these little circle areas are where they were saying there's the buildup or the obstruction of the coronary artery disease. They will take the other vessels that they've harvested from somewhere else in the body, usually the saphenous or the mammary artery, right, and they will attach it higher up off the aorta and then bring it down to the other side of the blockage to bypass it. So they're creating a different route of circulation to try and restore blood flow to the muscle that should have supplied. Okay. Next up is peripheral artery disease. So now we're talking about similar problems but in our peripheral or distal circulation. Right. It's a progressive narrowing of an artery. Right. It can be in the neck, abdomen, or extremities. Usually it's due to atherosclerosis. Right. It progresses over time, and then eventually the artery can get completely occluded or blocked. Same deal. It causes ischemia and lack of blood flow. It's at high risk of rupturing, and it can cause a thrombus or an emboli to form, or the blood vessel itself can rupture in an aneurysm. This is just an image of somebody who might have atherosclerotic arteries in their leg and how it can impair blood flow. Right. Things that increase people's risk. The top 4: smoking, hyperlipidemia, hypertension, and diabetes mellitus. Patients will complain of these signs and symptoms. Right, they will have paresthesias, that's like pins and needles or numbness and tingling feelings. The skin on the affected area is going to be shiny and tight looking. They often won't have hair growing on that side because there's not enough circulation to support it. The pulses may be weaker or absent. The limb may look paler or even red. Right, they will often complain of pain at rest. The muscles themselves will look smaller on that area because they're not getting the nutrients they need to stay healthy, and they're atrophy. They can have delayed wound healing, and they can get gangrene or necrosis infections. Here's an image of a gangrene. Right. To treat them, they have to have bypass surgery. Right. So they will take a graft from another vessel in the body and do the same thing like the cabbage, where they will go around that blockage area and create a new method of circulation. Right, the body itself can also grow collateral circulation around a blockage, but it takes a significant amount of time. So if it's immediately causing damage and high risk, then they're not going to be able to wait. Another complication to blood flow would be aneurysms. This is an outpouching or dilation of an artery wall. The problem is that the larger it gets, the greater risk it is of rupturing or breaking, and then you have bleeding of an artery into the body. Atherosclerosis can also cause an aneurysm to occur because it's going to weaken the lining of the artery. A common place for aneurysms is an abdominal aortic aneurysm between the two areas of bifurcations of the main blood vessels going down through the body. On an angiogram, this is what it would look like, where you can see normal size and then this big outpouching here, that's the aneurysm. All right, we'll pick up next with valvular disorders of the heart.